Hello there, we'll talk today about human immunodeficiency virus, HIV. We'll talk about prophylaxis, pre-exposure. We can take tenofovir, diazoxyribophosphate fumarate, imitricitabine. If patient exposed to HIV, we'll do the following. Immediate test, we'll do immediate test, and take tenofovir, imitricitabine, raltegravir for 4-week duration, and test up after 6 week, 12 week, and 6 month. What about the screen? Screen by combination immunoassay for HIV 1, 2, and P24. If positive for combination immunoassay, do immunoassay for HIV 1 and 2 to know the type. Positive will confirm the diagnosis. If immunoassay inconclusive, obtain nucleic acid amplification test NAAT NAT. If a NAT is positive despite antibody is negative, this means acute infection of HIV. What about the presentation? Patient with HIV, with acute HIV, is present with fever, several weeks post-exposure, fatigue, lymphadenopathy, rash, pharyngitis, headache. Window period. These on window period. Primary infection diagnosis by nucleic acid amplification test, NAT. Important note. Note that test for all HIV patients with following sign and symptom of immunological dysfunction: weight loss, fever, night sweat more than 2 weeks, severe aphthous ulcer. These are signs of immunological dysfunction. What about viral load? Viral load is a test for prediction to. It is the best predictor, for prediction to AIDS progress or death. CD4 count also is very important, but for what is a marker for the risk of opportunistic complications. Definition of AIDS. It is HIV person positive plus CD4 less than 200 per microliter, or if the AIDS divine illness is present. Well, what about the treatment? Treatment by ART, antiretroviral therapy. Treatment: choose either of the following: LAD, Tide, Tassel, Tear. These antiviral medication: lamivudine, A, alphanamide, D, dolutegravir, Tide, T, tenofovir, A, alphanamide, E, imitricitabine, D, dolutegravir. Tassel: T, tenofovir, A, alphanamide, C, copistat, E and EL. E, imitricitabine, EL, elvitagravir. Tear: T, tenofovir, E, imitricitabine, A, alphanamide, R, raltegravir. Viral load should be checked 4 weeks after beginning of the ART. Breastfeed also should be avoided in HIV women. Pregnant women typically not differ from non-pregnant women treatment, except for that point. Should note that alphanamide try to avoid, tenofovir, imitricitabine, and cobicistat should be avoided. What about IRIS? IRIS mean immune reconstitution inflammatory syndrome. It is a condition seen in HIV patient. It is intense inflammatory disorder associated with paradoxical worsening of pre-existing. There is pre-existing infection, subclinical infection will appear after ART treatment. When the immunity get better, the subclinical infection will appear. Of course, HIV infection opportunistic in some multiple disease, so the subclinical disease will appear. Glucocorticoid aniside have a role in IRIS treatment.